chapter 1, page number 4 onwards. This chapter is basically the snapshot of all the other following chapters. Just the highlight of all the chapters are included in this particular chapter. Okay, but when we go to the next chapters of carbohydrates, lipids, proteins, old, young, female athletes, okay, we'll talk about those in detail, hydration, etc. Okay, we'll talk about all those aspects in detail, but in this chapter, we'll just go through the snapshot of all the other aspects of sports nutrition. Okay, so the guidelines which you find in this particular textbook of sports nutrition, which you have, okay, it's based on these organizations. Okay, these are fairly international as well as national organization. The as sports nutritionist, you may have to constantly refer to the findings and researches done under these institutions even in the future. Okay, these are quite their research studies, etc. Even the studies which are mentioned in the textbook. Okay, when you read the textbook, you'll come across various studies. No need to buy hard that studies. Just grab the insights of that studies. Okay, conclusion part of the studies are given in the textbook. Just remember those conclusion. Okay, these studies have been done, and these are the insights and knowledge that we already have. Okay, so joint position statement of nutrition and athletic performance by the American College of Sports Medicine. They do publish various studies, so you keep like Google about them, and you will keep getting the notifications from them as well. Okay, Academy of Nutrition Dietetics and Dietitians of Canada, International Olympic Committee, consensus conference on sports nutrition. Okay, so all the guidelines which they represent have been grasped into this particular textbook. Okay, so first coming to energy. So what we usually check here, okay, as a nutritionist, if you want to give an athlete an insight about what is the caloric requirement this particular athlete should have, okay, always it's the best option to go for what is their fat free mass. You can take various DEXA scan, okay, such medical test you can take conduct, and through that you can understand how what is your fat free mass. Okay, so what is fat free mass? Your bones, muscles, organs, okay, fluid. So these aspects inside your body are the fat free mass. Once you get a DEXA scan done, okay, there are various other measurements as well. Okay, if you can do this scan from a hospital, you will understand what amount is your fat free mass. For example, you are 60 kilograms. Okay, your weight is 60 kilograms, and the fat free mass which you have in your body, okay, is, let's say, about 25 or 30 kilograms. Okay, so let's say it's 30 kilograms. Let's take half of your body is fat free mass. Okay, you have a lean body and half of your body is fat free mass. So what would be the calorie for this person? 45 kilocalorie is the upper limit. Okay, so what could be the calorie intake for this person? If you have a calculator, the total weight of the person is 60 kilograms. When we did the DEXA scan, etc., we understood that the fat free mass, the body mass that does not have fat, okay, the body weight that does not have fat, organs, tissues, ligaments, tendons, okay, they do not have fat. Okay, so that part of this particular person's body weight is just 30 kilograms. Okay, the patient 30 kilograms of the body is fat free mass. So what would be the energy intake for them based on the first point to maintain that optimum health? What should be the calorie intake? Just check your calculator and do the calculation. Is the question like, did you understand the question? Yes, 1350 would be the calories that you can suggest them. Okay. And if it is a female athlete, if it is a female athlete, the lower limit should be at least 30 kilocalories per fat free mass per day. Okay. So if you do not want to go much into the calculation, but you want to be very exact about the calories uh, to be given to this particular athlete without putting them onto a weight parameter, okay, without increasing their weight, you want to maintain the current weight of the athlete. Okay, this is what you can suggest. Okay. Then we have relative energy deficiency in sports. It's a syndrome which is usually associated with eating disorders. Okay, like what usually athletes may think is that if I have less food, I'll not put on weight. If I don't put on weight, I will be performing better. Okay, people have this kind of conception. So what they do is they purposefully eat less. Okay, and when they eat less, obviously there will be an energy deficiency. Okay, because the food is giving you energy, it is giving you calories. Okay, so when they eat less, there will be energy deficiency, but then an energy requirement is high. Definitely athletes would be training at least for 5 to 6 hours per day. Okay, and if they do not provide their body with sufficient energy to burn that kind of calories, okay, you will go into a energy deficiency state. Okay, and when it comes to females, okay, when females go into this relative energy deficiency state, that's when you get into this female athlete triad. Okay, female athlete triad, in which you will lose your menstrual cycle, or you will suffer from very few menstruation. Okay, you will lose your menstrual cycle, or just one day of menstruation, less than 100 ml of menstruation. Okay, your bone mineral density will come down, you will suffer from osteoporosis. Okay, osteopenia or osteomalacia. Okay, which these are present usually in female athletes, these kind of symptoms. Male athletes will also go through similar this thing, not related to menstruation, but yeah, that bone density will come down, that they will lose their lean muscle mass as well. Okay, they can also go into a state of eating disorders. So that's about energy. About female, when we talk, when we will go to the chapter of female athlete, we will discuss in detail about the female athlete triad. Okay, so if a person, if an athlete goes into a relative energy deficiency syndrome, you can expect them to show these signs and symptoms. So now doing the calculation part of estimating how much calories one may require. Okay, so what we are doing here, we are using the same Mifflin and St. George formula. Okay, so first you have to estimate your resting metabolic rate. So for these are the formulas. Okay, for basal metabolic rate or resting metabolic rate, these are the formulas. There is just a small difference. For males, you will add 5, and for females, you will subtract 161. Okay, that's the only difference between these two formulas. Okay, you have to consider the person's weight, height, and age. Okay, in the second step, you will have to estimate their activity level. Okay, what kind of lifestyle they have. Uh, so this is how you can, if they have a sedentary lifestyle, athletes will not have a sedentary lifestyle. Okay, but for other general public, so sedentary lifestyle, that PAL, physical activity level. Okay, PAL means physical activity level, will be 1.1. Okay, lightly active 1.3, moderately active, and very active. These are the two categories where you have to put the athlete in. For example, if you are getting a golfer, okay, a person who plays golf. Okay, in which category will you choose? Moderately active or very active? A person who is a golfer. They are moderately active. Okay, so you have to, so based on the level of physical activity, when you hear about different sports, okay, different kinds of sports and games, when you hear about that, you will definitely know what would be the activity level for that particular sport. Okay, for if it is football, basketball, cricket and all, they are the athletes do come under very active. For cricket, you will also find certain athletes who are moderately active, not that active. Okay, not all cricketers are like full time on in gym or getting trained. Okay, So then you multiply these two values, the values you got in step 1, using this Saint Gior and Mifflin equation, and then multiply the physical activity level, whatever is for your patient. Okay, so that's how you calculate your calorie requirement. So next, coming to body composition. Okay, for females and males it is different. The main body composition is given here. Muscle tissues, for males it is 45, females it is 36. Essential fat required 3 and 12%. For females you require more fat because you have to also regulate your menstrual cycle. Okay, if a female athlete's essential fat required goes beyond 10%, definitely she will lose out her chances for fertility. Okay, it will definitely affect her fertility if her fat index goes beyond 10%. Okay, non-essential fat storage 15 for females, for males it is 12. Bone it is 12% for females, 15 is for men. Okay, and other organs it is almost similar. Okay, so in this particular topic, you have to understand this important point, that a female's essential fat requirement, as well as not essential fat requirement, stored fat like adipose tissue. Okay, adipose fats are the stored fat. Okay, so it is required in higher quantities for females. Okay, even though their fat consumption is lower than males, the storage capacity of fat, it is much higher in females as compared to males. Males can burn fat easily, okay, but not females. It is stored for the females just to support their fertility and their reproduction. Okay. So next, coming to carbohydrate. Okay, the type of activity, again, what is the intensity of the activity that they are performing, and what is the recommended carbohydrate index. So here you just have to focus on these last two areas. Okay, athletes who do high intensity endurance exercises, okay, for 1 to 3 hours per day, and for moderate to high intensity exercises, which is more than 4 hours per day. You just have to remember these two when you are dealing with only sports and athleisures. Okay, so you have to just remember these two columns. If you're going to some sedentary lifestyle, if you are practicing as an overall nutritionist, you can definitely remember the entire table. Okay, so always keep the carbohydrate, recommended carbohydrate should be below 5. Below 5 for people who are sedentary and moderately active. It is always above 5 for high intensity. As soon as endurance exercise kicks in, okay, the recommended intake of carbohydrate should always be more than 5 grams per kg body weight. And also about carbohydrates, when you are suggesting high endurance activity athletes about sports drink, okay, give them the options of having like the sweetened sports drinks that can give them quick energy. Okay, even if there are certain drinks which you do not have to drink hot, you just have to gargle your mouth with. Okay, because as soon as the saliva gets mixed with certain glucoses in the stomach, sorry, in the mouth, when you gargle your mouth with, or rinse your mouth with, okay, it sends your brain the signal that more glucose is incoming, and the brain prepares the body to spend more energy. Okay, so that kind of drinks are also suggested. So carbohydrate is not the enemy usually when it comes about female athletes, especially female athletes. Okay, they consider high carb diet as not essential. It may give them they may be putting on weight because of high carb diet, but actually if you want to increase their glycogen stores in muscles, okay, carbohydrates is the only best option available. Okay, you can't expect glucose from protein to break down and be stored in the muscles. Okay, if you want high glycogen stores in the muscles, you have to focus on the carbohydrate intake. Next, coming to protein. Protein for athletes who have moderate intensity workout, 1.2 gram is fine. who have high intensity, high and endurance level activity workout, which is more than 4 hours, 2 gram protein per kg body weight per day. Okay. And just a rough amount, if an athlete is around 70 kilograms, okay, 84 to 140 gram is the range that we prescribe. Okay. And immediately after the exercise, they have to take protein. And why do we take protein immediately after the exercise, even before you go to sleep? Okay, the dinner that you have, for athletes, especially for athletes, the dinner that you have, that also should contain protein, because throughout the night when the athlete is resting, that's the time when the body muscles which had undergone certain degree of wear and tear throughout the day during the intensity of training and endurance activities, that will get fixed at night because of the protein content in food. Okay, specifically leucine rich food, which is found in almost all the dairy products. Okay, dairy products and animal foods have high amount of leucine. If you give a glass of milk at night for the athlete, okay, before they sleep, that will also provide uh, fixing the bone and tone out issues, as well as it will induce a good quality sleep. Okay, a glass of lukewarm milk. Okay, tables which I have shown here, similar tables are already present in your textbook. You can just follow those tables also. Next, coming to fat, um, not just for athletes, but also for your general population, for the general public, we always give them the same advice that whatever is your calorie intake, okay, the fats that contribute to that calorie should always be below 35%. Okay, for females and males as well. But the bottom limit, okay, the lower limit is 20%. Don't go beyond lower than 20, otherwise it will not help you out, especially for athletes. Okay, if you are completely going fat free, that will not be beneficial to the athletes. Okay, so keep it in a range between 20 to 35%. Okay, for females, if they can follow 20 to 25%, that is also fine. Okay, keeping 25% as an upper limit for females, that is also completely fine. Okay, but especially for male athletes, keep it at least 30% or 35%. Do not go beyond 35. Okay, that will lead to overweight issues and obesity issues. Okay, so the entire energy contribution that comes from it doesn't see the way how you are using. You can even use refined oils. Okay, refined oils can be used, but the amount of fats that you use, that matters. Okay, if for example, if you are using oil, if you are cooking a vegetable only in oil, definitely you will require more oil. Okay, but if you are steaming the vegetable, okay, and then just using oil just to temper it, okay, so which do you consider is more healthy? Cooking the entire vegetable only in oil, or just using it to temper the vegetable? Tempering, steaming the vegetables and tempering, so you have a better control over your fat intake. It's not that you're completely avoiding the fat. So when you are using refined oil for tempering purpose and all, it is not going to hurt you. Okay, it will be easy on your pocket as well, and it will not hurt you. If you want to be much more uh, if you want to be much more focused about your health, definitely you can uh, just substitute your refined oils with virgin vegetable oils and use it for tempering. Okay, so since virgin oils do come with a cost that is slightly higher than refined oils. Okay, so if you're using it just for tempering purposes, it will give you enough amount of fat, like fat also, and all the essential fatty acids which are available in certain virgin vegetable oils, that will not be lost. Okay, because when you are cooking the vegetable when you are cooking the cooking any kind of food completely in oil, okay, what happens is that the oil is going to be in touch with heat for a pretty long time. Okay, it's going to be in touch with heat for a pretty long time, and all the essential qualities that the oil may have, refined or unrefined, okay, whatever essential qualities the oil may have, it will lose it. Okay, the more you cook, the more it is in contact with continuous heat, it will lose its essential qualities. Even if it is virgin coconut oil or sesame oil, whatever, okay, it will lose its good qualities over a period of time when you are cooking the entire meal on oil. But when you're using it just for tempering purposes, hardly you have to heat the oil for 1 minute or 2 minutes and put your seasoning into it and just pour it over the steamed or boiled vegetables what you have already prepared. Okay, it adds the taste, flavors also, and more importantly, all the essential fatty acids are intact. You're not losing out on it. Okay, so that's a very good and a very healthy way to include oils in your regular diet. Okay, and saturated fatty acids in your diet should be less than 11%. Saturated fatty acids, even your coconut oil comes under saturated fatty acid, butter and ghee also, they also come under saturated fatty acid. So saturated fatty acids are not bad, definitely include them, but keep them to a limit. Okay, next, coming to hydration. Before starting the training, definitely hydrate yourself. 2 to 3 hours before you hit your gym or before they hit the training, definitely make sure that they drink water, which is around this range. Okay, 5 to 10 ml per kg body weight. Okay, males and females, whatever is their weight, at least it's better to keep go on the higher um 10 ml in seasons like summers. Okay, summers and springs. Okay, encourage them to have 10 ml of whatever water consumption or any fluid consumption, not just water but any fluid consumption, 10 ml of 10 ml per kg body weight. Okay, in summer seasons. In winters and cooler seasons you can skip it to 5 or 7 ml. Okay, that's completely fine. And make sure the athlete does not get dehydrated even during the training. Every 15 minutes or every 30 minutes or so, have a sip of at least 100 ml of water. Okay, every 15 minutes or 20 minutes is much ideal. Okay, every 20 minutes just take a sip of 100 ml of water, 75 to 100 ml of water, that is ideal. It will keep you hydrated. And if at all you know you are going to train in a very humid and hot climate, if it's possible, switch to sports drink. Okay, don't just drink plain water, switch to sports drink, because sports drink has sodium in it. Okay, sports drink has sodium as well as glucose component to it. Okay, especially in the months of summer, if you're training outside in the sun. Okay, it's a sunny day, you're going to train outside in the sun, jogging or trekking, something like that. It's always ideal to switch your water, your plain water, with sports drink. Okay, if you're training indoors, it's a cool climate, you know you're not going to sweat. Okay, you are not going to sweat much. There will be definitely, when you're training you will definitely sweat, but the intensity of sweat is not as much like the hot seasons. Then you can just drink water. But if you know you're going to lose a lot of water through sweat as well as electrolytes through sweat, switch to sports drink. Or even if you're having just plain water, if plain sports drink are not affordable by the clients, just add a pinch of salt into the water. Okay, and some glucose, shake it well and then drink it. Okay, because, and don't drink too much of water, avoid drinking too much of water, because that will lead to hyponatremia. That is, your sodium level in the blood will fall down, and it will definitely affect the way how your cardiac output is, how your heart health is, and it could be fatal as well. So do not encourage them to drink too much of water. Just based on their health and based on the intensity of the exercise that they're doing, based on that, water intake should be ideal. Okay, so before you start the training, hydrate well. Okay, urine should be clear. At least the urine which the athlete passes should be under this color range. Okay, 1, 2, 3. It's very pale straw colored urine, that should be the color of the urine. If it is getting darker and darker, yellowish, if it is more yellowish, means the person is dehydrated. During the during the training, just and whenever, please focus on your thirst mechanism. Okay, some people try to ignore the thirst. Even if they're thirsty, they will think that I will go on for 10 more minutes, I will go half an hour more, then drink water. So as soon as you focus on your thirst mechanism, you understand your tongue is getting dry, your lips are getting dry, means you are thirsty. Okay, even if the throat is not dry, do not wait for your throat to get dry to drink water. As soon as your tongue dries up, your mouth gets chapped and dried up, just drink water. And if it is flavored drinks, okay, like some not just sports drinks, even plain water also comes in certain flavors, it will encourage you to drink more. And after the training, hydrate yourself with water at least 1.5 ml into weight lost in training. Before training, what was your weight, and after training, what was your weight. Definitely you will lose certain amount of weight after training, and that's not completely your fat loss, that is your water loss. Okay, because if you had sweat, you did sweat a lot, means you had lost some amount of water. So that amount of 1.5 into the weight lost, the difference between the training sessions, before training and after training, what was your weight. So that difference, calculate, and that amount of water you have to drink. At least 750 ml to 1 liter per hour after training. Okay, and the combination of water, milk, any recovery drinks, smoothies, okay, is good. Especially it's better to go for yogurt smoothie. Okay, any fruit, any citrus fruit and yogurt smoothie is very ideal, because yogurt has a good amount of protein, calcium, and if you add a bit of water or some fruits also already has certain water component to it. If you have a yogurt smoothie, it's a very ideal uh, way. You can also encourage them to have buttermilk or lassi. Okay, if not yogurt, go for lassi. Okay, sweetened, or use sugar-free lassi or whatever, fruit lassi, etc. That is also really good addition, because you are getting a protein as well as water intake. Okay, because after training you definitely require protein to recover from the wear and tear. Vitamins and minerals. Vitamins are inorganic components that are essential to maintain healthy bodily function. They do not contain any energy. Vitamins and minerals will not have any energy, but they are like catalyst. Okay, with the presence of vitamins will enable other body functions to take place properly. Okay, especially hormonal regulation, making of hormones. Okay, distribution of other essential nutrients throughout your body. For this, you require vitamins to act as a catalyst. So minerals are also inorganic substances found in body that are necessary for the body to function adequately. So they also, vitamins like minerals and vitamins are called micronutrients. Okay, they do not provide any energy. And under minerals, we have to focus more on iron and calcium, mostly for athletes. Okay, because we if there is a reduction in iron, the hemoglobin levels will come down. If the hemoglobin level comes down, the blood will not have enough capacity to deliver oxygen to the muscles. Okay, because when you are working out, you require a lot of oxygen to be delivered to the muscles. If you come down on the iron ratio, it will definitely affect your performance. Okay, calcium, because you can't afford to have fractures that often when you're an athlete. It may impact your game, it may impact your training. Okay, and also it may affect your performance. So competition nutrient, before event, during event, and after event, each of these events are explained detailedly in various other chapters. We'll repeat those sessions all over again later. Okay, so pre-event, the amount of calories that you drink. Okay, this gram is about about carbohydrates that you have. 10 to 12 gram of carbohydrates at least 12 hours before the event, because you are just loading up. It will not make you fat. This amount of high carbohydrate load is not going to make the athlete fat. It is just going to convert the glucose into glycogen and fill up the muscles with glycogen for next day's sport event. Okay, during the event, use mouth rinses which has carbohydrates. As I mentioned earlier, when you rinse your mouth with drinks that have carbohydrates, your brain will get the signal that more food is going to come, and the brain will prepare the body to splurge on the carbohydrates that the body already has stored up. Okay, otherwise if the brain knows that no food is going to come, the brain will not allow the body to burn glucose, okay, or burn the glycogen. Okay, so to prevent that situation, using a mouth rinse, okay, which has carbohydrates is ideal. So after the event, replenish your glycogen by 1 to 2.1 or 1.2 gram per kg body weight. It's small snacks, okay? Don't go for a heavy meal soon after the sports event. You may vomit it out, okay? So just go for snacks that are carb-rich snacks and protein-rich snacks, okay? Go for that. And within 4 to 6 hours after the event, you can enjoy your full meal. This is also fairly the same. You can take a screenshot of it. Things that you have to avoid. All the 3 days, just avoid crispy, fatty, deep fried food. Okay. And do not include any new food or new cuisine the entire that week of the sports nutrition. Do not encourage this. If, for example, if it is an international event, okay, the athlete may have to travel to some other country for sports. Okay, so you may feel you may have the craving to try new cuisines, local cuisines out there. So don't go for that soon after the sports. You are done with the sports event. You can encourage the athlete to go out and have some fun, but before that they have to stick to their diet plan. Okay.